Good morning. This is Professor Avila. I just wanted to go over very quickly a nursing diagnosis for a patient who has an NG tube inserted because of a diagnosis of a small bowel obstruction. Okay, very simple. Patient comes into the emergency room, shows up to your floor, nausea, vomiting, abdominal pain. They have that classic upper abdominal distension, no bowel sounds. CT scan is showing small bowel obstruction. Abdominal x-ray, KUB is also showing an obstruction in the small bowel. So this is now your patient. The doctor has requested, ordered, and you put in an NG tube, and now you're going to be taking care of the patient. Let's talk about the reasons why. And here at school today, we're doing actually NG tube insertion. So obviously the tube would be inserted in, right? So we've got that in already, and we put in we've got our Lopez valve, right? And we've already verified placement, and the patient is now clamped to the wall with the NG tube insertion. So NG tube insertion is successful. So what is our care plan? What's that going to look like? So I looked up, it's very simple. You want to develop nursing care plans that are going to be very simple to create. Let's go over our 3 processes for your nursing diagnosis. First, you have to have that NANDA approved nursing diagnosis. Look at your list, look at your textbooks. You can even Google them. We're not reinventing the wheel. The NANDA diagnoses are set. They don't change. They're added to by the association. So we're going to go ahead and go, and I picked one today. Gastrointestinal motility, dysfunctional. Remember, your nursing diagnosis has to have 3 elements. Your nursing diagnosis from your NANDA approved list. Number 2, related to blank. And then third, as evidenced by. If you don't have those 3 elements, you do not have a properly written nursing diagnosis. Remember, this is not a medical diagnosis. The doctors have their own diagnosis. Our diagnosis today is small bowel obstruction. The doctor treats the small bowel obstruction. The nurse also has to prioritize their day, prioritize the care of the patient, so we create nursing diagnoses. With that said, we have to have 3 elements. Once again, I cannot stop stressing your nursing diagnosis related to, as evidenced, ED, as evidenced by blank. Let me break that down very quickly. Okay. Remember, your nursing diagnosis is different from a risk statement. Risk for sepsis, risk for falls, risk for aspiration. That's different from your nursing diagnosis, first of all. So please distinguish between the 2. So let's go with our nursing diagnosis, and I'll show you very easily how to put this together. Gastrointestinal motility, dysfunctional, related to blank. That blank, that related to, let me just break it down very simple, and I'm going to say this in all the videos. The related to is basically the medical diagnosis or the cause, but in our nursing language. This is where you get creative. This is where the nursing lingo comes in. And that's, as you're a student beginning, you're going to notice that the language becomes a little bit more easy as your theory instructors are telling you about, talking to you about nursing lingo, once you learn how to develop your own nursing documentation. Okay, and then the as evidenced by is going to be anything, what I like to call scientific data, anything that you can see, hear, smell, touch, palpate, see on the monitor, anything that you heard the patient say. Okay, any radiology exams, that's your evidenced by. And I usually like to see at least 3 to 4 evidenced by when students are creating care plans. Okay, so we have so let's go with the evidence. Why did the patient come into the ER? Because they had abdominal pain. So there's 1. What else were they demonstrating? Nausea, vomiting, okay, distended abdomen, we have a CT scan and an X-ray that's showing small bowel obstruction. Okay, so there you go. So they have this, so let's put it all together now. Gastrointestinal motility, comma, dysfunctional, related to, would it be appropriate to say related to small bowel obstruction? No, we cannot use that because you cannot use medical diagnoses, physician's diagnoses, admitting diagnoses as you're related to. So let's get nursey. Let's use our nursing lingo. What is a small bowel obstruction? It's an obstruction. It's in the abdomen and it's small, so in the small bowel. So let's go ahead and change those words around. Okay, so related to, how about abdominal obstruction, okay, abdominal or GI obstruction, okay, so we're not using the actual technical term small bowel obstruction, but we're using the words blockage of abdomen, blockage of digestive system, digestive abnormalities and obstruction, okay, okay, as evidenced by all those other things that we just said. All right, let's put it together. Okay, gastrointestinal motility, comma, dysfunctional, related to abdominal obstruction or slash digestive system obstruction or blockage, as evidenced by nausea, comma, vomiting, comma, let's make it a little bit more detailed, vomiting 100 cc's over the last 15 minutes, comma, radiology demonstrating bowel obstruction, comma, okay, abdominal pain 7 out of 10 verbalized by patient, period. Okay, once again, gastrointestinal motility, comma, dysfunctional, related to, and you're going to have to clean this up and write this down, study it, get the word terminology right, abdominal obstruction in the digestive tract, as evidenced by nausea, vomiting 100 cc's over the last 15 minutes, pain rated 8 out of 10, and radiology indicating small bowel obstruction. Okay, so you could use possibly some medical diagnoses in your evidence, but if you don't want to, and if your instructor has said nothing, they're referring to the related to. But when we talk about the as evidenced by, we could say as evidenced by also medical diagnosis of small bowel obstruction as confirmed by radiology, CAT scan / KUB. Okay, I hope you enjoyed this video, and we'll talk to you soon.